Today we are going to discuss regulation of blood pressure. Now regulation of blood pressure or the factors which affects blood pressure we can say means neural mechanism or nervous mechanism, renal mechanism, hormonal mechanism and local mechanism or local factors which affect blood pressure. How these four factors will going to regulate the blood pressure. We'll see first neural mechanism, and this neural mechanism is the for the short term regulation of the blood pressure. And in this neural mechanism we have baroreceptor reflex, chemoreceptor reflex and Cushing reflex. So first of all we'll see baroreceptor reflex. Now when we see baroreceptor reflex, and when this baroreceptor reflex comes into an action, whenever there is increase in the blood pressure, there is a stimulation of baroreceptors. Whenever there is a increase in the blood pressure, there is a stimulation of baroreceptors, and because of stimulation of baroreceptors, there is a stimulation of nucleus tractus solitarius. Whenever there is increase in BP or blood pressure, there is a stimulation of baroreceptors, and that baroreceptors send impulses to the nucleus tractus solitarius, and there is a stimulation of nucleus tractus solitarius, and two things will be there. After stimulation of nucleus tractus solitarius, inhibition of the vasomotor center, and there is a decrease sympathetic tone, or there is a decreased sympathetic nervous system. Sympathetic nervous system will or decrease sympathetic tone, and stimulation of cardioinhibitory center means there is a parasympathetic nervous system comes into an action. That means vagus nerve will get stimulated and there is increase in the vagal tone. Means here there is a decrease in the sympathetic tone, and here there is stimulation of the parasympathetic nervous system, or there is stimulation of the vagus nerve or increased vagal tone. Means because of the decreased sympathetic tone, what happens when there is a decreased sympathetic tone? The first effect on the blood vessels means there is a vasodilatation or venodilatation, means arterial and venodilatation, that leads to decrease in the total peripheral resistance, and because of that there is a decrease in the blood pressure because of vasodilatation. Why vasodilatation? Because there is a decreased sympathetic tone. This decreased sympathetic tone, which when it acts on the adrenal medulla, there is a decreased catecholamine secretion. Decreased catecholamine secretion means adrenaline, noradrenaline, dopamine, decreased catecholamine secretion, and because of that there is a total peripheral resistance is also decreased, and that's why there is a decrease in the blood pressure again. On the heart, decrease in the heart rate, so decrease in the cardiac output, so there will be a decrease in the blood pressure. So basically what happens when there is an increase in the blood pressure, baroreceptor comes into an action, it sends impulses to the nucleus tractus solitarius, inhibition of the vasomotor center, decreases sympathetic tone, stimulation of the cardioinhibitory center, increases vagal tone, and ultimately there is a decrease in the blood pressure. So this is the baroreceptor reflex. Now chemoreceptor reflex. This chemoreceptor reflex, they are located in the carotid body and aortic body. Location of the chemoreceptors, they are located in the carotid body and aortic body. And when this chemoreceptor reflex comes into an action, whenever there is a hypoxia, hypercapnia or acidosis, they act through the respiratory center, and they came into action when blood pressure is less than 60 mm of mercury. Means whenever there is a hypoxia, whenever there is a hypercapnia, stimulation of chemoreceptors, and because of that there is a stimulation of the respiratory center, they act through respiratory center, And what happens here? Now there is a decrease in BP. So there is a stimulation of the vasomotor center. So there is increase in the sympathetic tone and inhibition of the cardioinhibitory center. That means there is a decrease in the vagal tone. And ultimately there is increase in the blood pressure. Now Cushing reflex. Cushing reflex when blood pressure is less than 40 millimeter of mercury. Means whenever there is a cerebral hypoxia, there is a direct stimulation of the vasomotor center. There is direct stimulation of the vasomotor center, increase in the sympathetic tone, and because of that there is a vasoconstriction. Means there is an action on the blood vessel, there is a vasoconstriction, venoconstriction, and there is a secretion of catecholamines, release of catecholamines, increase in the total peripheral resistance, increase in the blood pressure, increase in the heart rate, increase in the cardiac output, and increase in the blood pressure. So basically whenever there is increase in the sympathetic tone, means sympathetic nervous system comes into an action and vasoconstriction occurs. So blood pressure increases with reflex bradycardia. So this is the Cushing reflex. Now we'll see the renal mechanism. Now we'll see the renal mechanism. Now renal mechanism, whenever there is a decrease in blood pressure, stimulation of the juxtaglomerular apparatus. Whenever there is a decrease in blood pressure, stimulation of the juxtaglomerular apparatus, and because of that increase renin production. Renin is the hormone. Increase renin production, and that renin converts angiotensinogen into the angiotensin 1. Whenever there is a decrease in blood pressure, renal mechanism, stimulation of juxtaglomerular apparatus, and because of that there is a increased renin production. So that renin converts angiotensinogen into angiotensin 1, and angiotensin 1 into converted into angiotensin 2 with the help of enzyme angiotensinogen converting enzyme. Angiotensinogen converting enzyme converts angiotensin 1 into angiotensin 2, and this angiotensin 2 is the main mediator for the vasoconstriction. Means it will going to act on the blood vessel. It causes vasoconstriction. So increases total peripheral resistance, increase in the blood pressure. So it's a main mediator for the vasoconstriction, and it is main mediator for increase in the blood pressure. So if you want to reduce the blood pressure, if you want to decrease the blood pressure, if you want to lower the blood pressure, you have to inhibit this angiotensin 2. How will you inhibit this angiotensin 2? By inhibiting this enzyme, angiotensin converting enzyme. How will you inhibit this angiotensin converting enzyme? By giving ACE inhibitors. Again, what you can do? You can give direct renin inhibitor. If you inhibit this direct renin, which converts angiotensin gen into angiotensin 1, so if there is no formation of angiotensin 1, there will be no formation of angiotensin 2. So we can use direct renin inhibitor, or we can use angiotensin converting enzyme inhibitor or ACE inhibitor like captopril, enalapril, or direct renin inhibitors like aliskiren. So angiotensin 2 is the main mediator for the vasoconstriction. This angiotensin 2 also causes aldosterone release. Means it acts on the adrenal gland, and there is the release of aldosterone, which causes sodium and water retention. Increase in the sodium and water retention, increase in the extracellular fluid volume, increase in the blood volume, and because of that there is increase in the blood pressure. So basically this angiotensin 2 causes increase in blood pressure because of there is increase in the blood volume. Why there is increase in the blood volume? Because there is increase in the extracellular fluid volume. Why there is increase in the extracellular fluid volume? Because sodium and water retention increases. And why is it so? Because of aldosterone release. This angiotensin 2 also causes cardiac hypertrophy and remodeling. It also causes mesangial cell proliferation, and it also causes metabolism of bradykinin, which is a vasodilator. So it causes metabolism of bradykinin, which is vasodilator. So these are the effects of angiotensin 2, and this is the renal mechanism. Now hormonal mechanism and local mechanism. Hormonal mechanism. So these are the hormones which increases blood pressure, and these are the hormones which decreases blood pressure. Adrenaline, noradrenaline, thyroxine, aldosterone, vasopressin, angiotensin, 5-hydroxytryptamine or serotonin. These are the hormones which increases blood pressure. Vasoactive intestinal polypeptide bradykinin, prostaglandin is a vasodilator, histamine is a vasodilator, acetylcholine is a vasodilator, atrial natriuretic peptide. So these are the hormones which decreases blood pressure, right? Now local factors. Local factors like endothelin 1, 2, 3, they release whenever there is a stretching of blood vessel. They act on the phospholipase. There is action on the phospholipase. Now two things will be released from the phospholipases: prostacyclin, which is a vasodilator, and thromboxane, which is a vasoconstrictor. Prostacyclin is a vasodilator and thromboxane is a vasoconstriction, and that's how there is a maintenance of normal blood pressure. Now local vasodilator like nitric oxide, it is also called as endothelial derived relaxing factor, which is synthesized from the arginine, and this is a local vasodilator. So this is how there is a regulation of the blood pressure.